forgot if they were in the packet. I missed them. So
I don't think I saw them either.
Okay.
Maybe, Ray, you can put them up on the
Yep,
screen.
absolutely, sure.
tried to click through everything.
That's okay. Sharing screen.
Oh, and I guess I should state for the record that all board members except Sue Hanley are present.
Okay, so these are the October minutes.
Okay.
And they were scanned in as part of the packet.
Do you want to, are we doing October 1st or November 1st or?
October, Wednesday, October 13th.
Yeah, they were, the 8th was first. Just in the way it showed up in the packet.
Oh, in the packet, okay. Did anybody see anything in the October minutes to change?
On page 3, third paragraph down says that there are 30 active COVID cases. We just need to make that say COVID cases in town.
Oh, yeah.
Hope we don't have any virus.
Okay.
Excuse me.
At the end of page 3, there's a sentence, maybe it makes sense, I just don't understand. It says, Granger stated Middlesex County has dropped from an elsewhere to exercise, then returned to our town.
So, yeah, I thought it was me, and somehow I printed out only the odd pages. But now that I'm looking at it again, there's only the odd pages.
Oh, page 4 is missing. Okay.
Yeah.
Oh, okay. That's what didn't make sense. Yeah, we're missing the even pages.
So we're going to have to, it's the same for the other.
Are they both?
Until I just started looking at it again, I'm like, how can I print out just the odd number pages? But they're not.
Were they double-sided and we only got scanned?
Oh, that's what it was. Okay.
So our administrative assistants knew, and I don't think she knew that because she was scanning the packet. I was working from home.
Yeah. Okay. So
my bad. I didn't pick up on it.
Would anyone mind if we waited till next meeting to approve?
Yeah.
I think that's fine.
I need to wait. Yeah. That's funny because I sat down to read them. I'm like, hold on. I thought it was me.
I like that sentence though. Granger stated Middlesex has dropped from elsewhere.
From elsewhere. It just says dropped from the elsewhere. The cyber weird world.
Okay.
All right.
Well, I guess, do we need to make a motion to table them to next month or do we just move on?
We can just move on.
Yeah.
Okay.
We'll put those on for January.
With the odd pages as well.
Apologize.
That's okay. Our next agenda item then is the variance request for 75 Groton Road. And Ray.
Yes, so Jeff Hannaford from Nose Design did reach out about 25 minutes ago and said they thought they had all the paperwork in. They were waiting for this last piece. And so they've asked for a continuance till January.
Okay.
If that's okay with the board.
Sure.
Fine.
They're waiting on some final easement paperwork.
Then we will not have to do with that this evening. Since people may be here for COVID or maybe wanting that at 6:30, I think we'll wait and take some other items out of order.
Sure.
So then the next item would be the discussion and appointment of our health director. Zach, do you want to
Yeah, kind of give a summary of the interview process. So yeah, Stephanie and I, along with Pam and Jody, interviewed 3 candidates for this position, including Ray, who's with us tonight. I think that we had discussed some possibilities of possibly bringing in another round of interviews in executive session. We've done that in the past, but Jody informed us that that is no longer an option with executive session. It would have to be at public meeting. And so Stephanie and I talked about it a little bit more, and I think, I won't speak for you, Stephanie, but I'm feeling really confident in appointing Ray to be our health director. Love to hear your thoughts, Stephanie. And then I thought we would, bring it for discussion to the board. And if the board felt like it tonight, I think we were thinking that maybe we would vote on it tonight.
I agree that we spoke. The candidates were all 3 terrific, but I agree with Zach that I'm comfortable offering this position to Ray if the rest of the board is in agreement. I spoke with Sue Hanley offline because she wasn't able to be here with us this evening, and she fully supports Ray as our next health director.
I just want to state that, I've been working with Ray, I think your entire career here, and I feel really lucky to have been doing that, seeing you in all the different positions along the years, always feeling really confident and comfortable with you in all those positions. And I feel like you seem really ready to take over this position. I've been really impressed with the work you've been doing as interim health director during a not so easy time. I mean, we've not only had COVID, obviously, not only did we have the previous director leave with, fairly short notice, but also the fact that we are short staffed and you've had to deal with all of that. And it's been a lot of hard work and you've been dealing with it really well. So that's been really impressive to me. I thought your interview was fantastic. I think that all of your experiences and the way that you handle, we had a lot of tough questions during the interview of how you would handle things. I thought you really had great answers, and I'm really looking forward to working with you. I think I think you're going to be great.
Thank you.
I, for one, am also in agreement. I'm very happy, having been on the interview committee, that is what you both came up with. Like you, Zach, I've known Ray for a very long time, even back in our internship days with MHOA. So I'm thrilled. I think we're in great hands.
And I agree as well. I think Ray has really performed outstandingly over the past, challenges of the past year. And I think we'd be really thrilled to have her at the helm of the health department for us.
And I'm grateful that we have people who still want to be health directors after the last couple. So thank you, Ray.
Thank you so much. I really appreciate the opportunity. I'm so excited and so enthusiastic. I really appreciate the nomination and the trust and all of your support. So thank you so, so much. I hope to make you proud.
We know you will.
You already do. Yay.
Do we need to actually take a vote on this, or?
Yeah, I'll make a motion that we appoint Ray Dick to be our Westford health director.
I second.
Okay, motion made and second. All in favor, say aye.
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 Right, motion passes with the 4 votes unanimously.
Thank you very, very much. Thank you. I'm so excited to work with the community and to continue working here. I absolutely love working here in Westford, and I'm looking forward to it. Thank you so much.
Appreciate your commitment to our town. So that's great. Would you like to provide, are there any other, well, now we'll have a vacancy, another vacancy to fill, but we'll work on that in January.
No, absolutely, Madam Chair. Brittany Nash is going to be starting with us December 27th of this month. She is going to be our new Community Health and Wellness Coordinator through the Public Health Grant. So she will be starting. We're very excited. She has a great background in mental health and substance abuse, as well as a bachelor's degree in public health from UMass Lowell. She was our best candidate out of all of the folks that we interviewed. So we're really excited. She's very enthusiastic and a new mom, and really excited to bring her onto the team.
The idea is that what will she be doing? This is for the 4 towns, correct?
Yes. So this will be shared between the city of Lowell, the town of Acton, town of Westford, and also the town of Dracut. So she will be full-time position, paid through the Public Health Excellence Grant. She'll be full-time benefit employee, will sit in our department and work with all 4 communities. Each community has a little bit of a different need as far as mental health, substance abuse, community health education. But she's excited. We're looking at our community needs assessment, strategic plan for accreditation, and she's ready to get started. So she brings a lot of experience and knowledge.
Ray, will she travel to the different communities on different days of the week, or will she remote in, or how will that work?
So with COVID right now, it depends on the community. Some communities would prefer that she Zoom and be remote. There are meetings for some of our substance abuse groups right now that are actually meeting in person, so she'll be able to travel. The travel will be included in the grant, all of her equipment. She'll be able to work remotely as well, which I think was really convenient for her, being a new mom and whatnot. So, she'll be able to check in with myself as the host agent every week. And like I said, she does have a physical space in our department.
And just another question, will residents have like office hours? Will she be available for personal, or will that be also done remotely? Do you know?
Absolutely. So she will have office hours. She's working Monday through Friday, 8 to 4, is the rest of the team. And so she will have office hours from 8 to 9 and then 3 to 4. And any appointments that anyone wants to make or has questions, she'll be available. Absolutely.
Great. Thank you.
Sure. So she is one of our new hires. Today, we also conducted several interviews for contact tracers for the community. We have 3 solid candidates that I am in the process of checking their references right now and working with the HR department to bring them on as soon as possible. They all have contact tracing backgrounds with Partners in Health. One's a nurse, 2 are already MAVEN ready. So we're excited to bring them on. Our school nurses have been quite overwhelmed, and as you've seen, the cases are significantly growing. So we're excited to bring them on.
Thanks. Any other updates?
I think as far as staff goes, that's pretty much it right now. So thank you.
That's a lot. Thank you. All right. So then, since it's 6:17, let's go ahead with our discussion of the ARPA funding, or American Rescue Plan Act funding.
Sure. So I did send you in your packet the latest Excel spreadsheet that we have for ARPA funding. Tomorrow night at the select board's meeting, they're going to be going over which groups, which departments they're going to be approving initial ARPA funding. And my understanding is they're going to be approving the first phase, if you will. You can see we put in for several different line items, everything from pretty much to do with the pandemic. I did send a separate sheet. I know that the town had asked for breakdown on what it would cost for a typical booster clinic. So I sent you that write-up. And then the second piece that they wanted to see was our breakdown of the $200,000 request you had asked at the last Board of Health meeting. Our understanding is just a blanket emergency fund for hazardous materials or foodborne illness emergencies would not be adequate for approval. So they asked us to break that down. Right down to minuscule amounts. So for one-time costs, for long-term costs, we did put in for a tobacco control coordinator, as well as social media manager, trying to keep up with all of the latest and greatest science. Due to the pandemic can be difficult with all our social media platforms, as well as our town website. Just this week, there's quite a few updates between booster clinics being available, booster vaccines for 16, 17-year-olds. And we want to make sure we're getting out the latest information to the community and residents. So that information was sent to you and available so that you can see that. If anyone wants to attend the meeting, I will be on tomorrow. It's virtual for any questions that they may have. And I don't know, Stephanie, if you want to go into the meeting that we had. I know the board had some requests.
Right. So we had previously been.
I think you just muted Stephanie.
Oh, there you go.
Very good. So previously we talked about asking Jody to come and speak with us. Ray and I met with Jody and Tom Clay offline to discuss the Town and Safety Task Force community health position. And it is being funded. They're looking for funding rather through ARPA for that position. I think it sounds like a very good position. They're looking for somebody with a social work background. I mean, I definitely support having the position. I still don't understand the placement of it, not in the health department, because it seems to me that it falls directly under the health department's set of responsibilities. But having the position would be better than not having the position in the town, I guess is sort of where, and so it kind of seemed like if, yeah, I don't know, Ray, do you have anything to add to that? Or
no, I think it was a very productive meeting. You know, we were happy to meet with Tom and Jody. They were very helpful, responsive, you know, willing to help, and they understood our opinions. We did certainly reflect that, you know, we felt this position should fall under the leadership of the health department. Certainly, we don't want to see anything get crisscrossed between the two community health coordinator positions. However, we are excited to see that this will be available for the community. So, you know, certainly up to you all if you want me to pursue something more, whether a letter just stating that, you know, we continue to feel that way, or, you know, Jody said, you know, she was very clear that, you know, it's to fall under the town manager's position. There's not a physical space in our department, but they did have a physical space available in another portion of the community. So,
and was that the main reason? The physical space reason?
No.
I felt that because it was a coordinating position, that their role would be to coordinate between the health department, schools, police, and fire, that it might be easier situated there. And then space-wise, they felt it was really important. I don't see a reason that space has to actually be physically located in the health department, but they want to make sure that there's a private space so that this person can meet with people privately as needed to discuss some sensitive issues potentially. So I mean, I think that's a good point, and to have that, regardless of which department it's housed under, having that space is important. But
can the Board of Health and the health director direct this person at all, or is this person have no, like, we do not tell this person anything? This all comes from Jody?
Yeah, so according to Jody, the Town and Safety Task Force has been the primary, you know, has primarily looked over this position, put this position together, and the group has made the decision that this position would lie under the town manager's office. So that is what we've been told, that's what's going to happen with the position.
I guess I'm just confused. I'm trying to picture a day-to-day, week-to-week kind of, like, again, like you said, Stephanie, I'm not against, obviously, the more positions the town can have in this area, great. I'm just trying to figure out if it's a coordinator position, that makes some sense to me. Like, I can understand, okay, this person's going to talk to all these different departments and coordinate, but but then being told that this person was going to have an office that, they're going to be speaking to residents in private and I assume doing, mental health work and so forth. The fact that our department won't have any oversight or managerial role over this position just seems like then, I don't know, seems to cause problems, because then when we're trying to coordinate with this person who's coordinating, I don't know, I'm very confused as to how efficient it's going to be and how effective it's going to be if we're kind of hands off. And so again, I'm not against it. If it can provide help to people, that's great. But I'm just really surprised that there's no input from us on how to make this work.
I agree with Zach. I mean, if this is a mental health position, it ought to be managed by the health department. And it doesn't matter if they're sitting within the health department space or on a different floor in the building. They're still in the building. And still, I think we should write a letter and state that we would like to have this position report to the health department or the Board of Health.
Did they explain how the Health and Safety Task Force decided that this position, which sounds extremely similar to our Health and Community Wellness, I forget what title that person is, it sounds like they're going to be doing the exact same job.
When they describe the job, it sounds a little different. This sounded a little more towards a counseling end. But I mean, as they described the job, it still sounded 100% like this fell within and under the health department's responsibility, like under our charter of responsibilities.
Well, if that's the case, if you're saying that this person is more of a clinician, right?
They're hoping to hire a social worker.
That's doing actual client, one-on-one client work. How does that position fall under the town manager and not under the health department?
Well, my understanding is too, and Stephanie, certainly speak up if you feel different. From the meeting, what I gather is Jeff Stevens sat on the group for, the year and a half or 2 years that the group was meeting. I can't speak to, what happened at those meetings or, what was suggested. She did mention that, we had someone from the health department sitting in those meetings and, working with the task force. Certainly, from my perspective, looking at the two job descriptions, there is a lot that's similar. However, it does appear that the one that will fall under the town manager's office is a clinician background social worker that will deal with immediate concerns for mental health and substance abuse issues.
I think that I agree that it would be great for us to write a letter, say that we support this position. We believe it's a very important position, but that we also believe that ideally it would be under the health department, as it completely falls within the health department's set of responsibilities, and that the risk of overlap and duplication of services is significant if it's located outside of the department.
Right. I feel like if we were to introduce a new position that was, plumbing inspector, and we were like, and it's going to be under the health department, we would get a letter from the, select board that would say, no, I don't think so. That doesn't, yes, we need a plumbing inspector, but it doesn't fall under your purview. And this just seems clear to me. And I'm very also worried, I'll be honest, I totally understand that, Ray has to work with Jody and the select board, so it's not maybe her position to say yes or no. But I do remember talking to Jeff that he had been on those meetings, and I remember that a lot of those meetings were very sporadic. There was large chunks of time where they didn't meet or didn't discuss this particular thing. And so it's possible that this wasn't really a topic of discussion at many of the meetings until fairly recently, or very sporadically. And so I feel like we would have heard more if this had been something that had been proposed early on. So to say that we were involved in the process, I find that hard to believe.
I agree with you, Zach. I think maybe we could have a conversation with Jeff. I mean, he didn't move to the moon. And I don't necessarily, like you, think that that's the whole story. Yes, there was somebody there, but my recollection isn't that he had ever said this type of position wouldn't fall under the health department.
Right.
I mean, I know we had discussions about this back when, you know, some of it was coming up, especially when the grants were first announced, and the ability to get a community health worker was part of the grant parameters. That I know there was discussion that this group was trying to kind of grab the money, sort of, if you will, and he put a kind of a halt on that, saying, no, this is the grant, this is going to be under the health department, this is what we're going to get. So I'm throwing some shade on that one, I think.
We need to write something very quickly because they're meeting tomorrow, and I think it would be appropriate to have the letter tomorrow for them. Do we want to really quickly kind of pull out the points that we think should be in the letter?
Sure.
I guess I'd also like to know why if we're getting this position in the grant, then that was already known. Why are they creating almost a parallel position?
It is different. I mean, I think when I read the job description and when they describe how they view the position being used, there is some overlap, I think, but it's a slightly different approach. I mean, having their goal is to have a social worker or something like a social worker in that role so that they're coming at it from.
I've seen that position in other places under the health department or under the police department. You know, dealing, because a lot of, you know, it starts with disputes on the police end, but not under the manager.
Yeah. And so.
I mean, it doesn't mean it can't be. I'm just saying. Right. It doesn't sound like it sits there naturally.
Yeah. So, okay. So what would we want to be included? That we're concerned that we support the position, but.
Right. Supervisory and oversight of the position we feel should be under the Board of Health. And I mean, we have institutional knowledge and experience in this regard that I don't think the select board or the town manager has.
It's a clinician. You know, that's what we have. We have nurses. We have, you know what I mean? Like.
I also think there'll be big inefficiencies if there's similar positions with different supervisors. So we could be repeating the same work. And I mean, as a taxpayer, I don't want to be paying for that.
Yeah, there are some areas that overlap. There are some clear differences, but some overlap. And do you want me to put, Stephanie, do you want me to put a letter together and have you sign it, or have all the board members sign that? Yeah,
I mean, can we all sign?
I'm happy to have you sign on my behalf if that makes it easier. I mean, I think we're all on the same page.
Yeah.
I mean, because the other piece of this is too, I know that the community health worker under the grant is, you know, shared services. So having this other position so that they can coordinate, they report to the same person, they can coordinate efforts, makes a lot more sense.
Sure,
Right,
and I agree with
I guess,
story.
you know, if there was some reason why the budget for this had to be under select board or town manager, like, I guess that's one thing. But if the day-to-day managerial and supervisory role is not under us, that makes no sense to me. So, I mean, maybe that's one way around it, is that it could be budgeted for under someone else's budget, but we would have at least, I'm not, like, this isn't a power grab here. I'm just looking for making sure that this position is working well for the town. And I can't picture a world where it works well when it's not, when we have no contact with this person, when we don't have, that doesn't seem to make any sense.
Right. And I mean, I completely can see them sitting wherever they need to sit.
Right.
It's still the coordination with the grants that we would, and they would both be applying for similar types of grants moving forward, and same type of education that we try and do and we'll be trying to, it just seems duplicative.
Right.
And I also can see them, at least in the beginning, reaching out to the health department to get contacts and find out where services are. You know what I mean? Like,
right.
They're going to be looking us. And so I want to, when we're done with this, bring up another topic that's related. So.
Okay. So everybody is comfortable with Ray putting together a letter. Would somebody like to do we need to make a motion that?
Yeah, I'll make a motion that I would like there to be a letter written to the town manager and select board stating that we are not in favor of, I don't know what the title of their position was.
Community Health and Wellness Coordinator.
Yeah, that they're Community Health and Wellness Coordinator. While we support the position, we don't believe it should be under the purview of the select board or the town manager's office.
I would second that, and also approve of Stephanie signing on behalf of the board, given the short time frame.
Agreed.
Motion made and seconded. All in favor?
Aye.
Aye.
Motion passes unanimously. All right, Ray, I'll squeeze that into my schedule tomorrow, my last day around. Let me know when to swing. Oh, you're not there, so you'll just send it to me and I can take it over, or how does that work? We can figure that out.
Yeah, I'll take care of it and send it over to you.
Okay.
Yeah, hopefully this can all be digitally done, right? Save you a trip.
Yeah. Okay, Joanne, should we?
Well, just in the course of this conversation, talking about space and all this, is that something that we should start thinking about and bringing up? I mean, we're bringing on more people. Town hall only has so much space. So does anybody know how this is all going to work going forward? People in these positions need to have private space. And we have a space problem. I don't know that it's being addressed, and I don't know that, and I don't know if Ray has anything to say, like from, the town side, or if it needs to, somebody needs to start the conversation. But I think public health is now in the forefront, and we're going to be getting, the ability to hire through grants and everything else. And if other people are also bringing in personnel, where are they all going to go?
I agree, Joanne. I believe we have to start this conversation.
Well, and I will say, from my perspective, that this is certainly a concern with the Public Health Excellence Grant. As you know, Joanne, the Department of Public Health is pushing for these folks to come on not as contractors, but they're looking to have them come on as full-time employees. For health departments. They're looking to expand health departments with more shared services and to see these positions come on full time, everything from tobacco, health directors to make sure that you meet the standards for the number of sanitarians you need for your department. So it is a concern. I know that the space where the police station is, the new proposed project, I know that those spaces have all been allocated for different offices and departments. Not really sure how to go about, maybe putting something in for the future for our department for more physical space. I know that some communities are looking to more remote positions and remote responsibilities and policies. But, I know that's not the answer for every position. We're public servants. We have to be available to the public.
Ray, can you speak more about, so in the, whatever that building's going to be called, Town Hall Extension or Community Building, do you know of any offices that have been assigned to the health department?
There are no spaces that have been assigned to the health department. I do know that this position, the proposal, I do not know if it's been approved, but the proposed position, the Community Health and Wellness through the Town and Safety Task Force, my understanding would an office has been allocated for that position over there.
So, I mean, this is, again, where I'm disappointed in the communication between Select Board, Town Manager, and our office. No, I don't recall ever being asked what our future needs were going to be when we're building a building that's going to cost millions of dollars, and we're not asked if we need any space in that building. And yeah, so I mean, I hate to be on our letter writing kick tonight, but I think that we need another letter to the Select Board saying that we need to be a part of future, present conversations about future space in town.
Okay. Yeah. I mean, I can only speak for myself. Again, I know a ways back when that building, when they were discussing what positions, what spaces would be going over there. I know our department was asked at the time. I could certainly verify that with Gail, but I know our department was asked at the time. Every department head was asked what the needs are. And I don't know what was submitted on behalf of our health department. I know just a couple months ago when I stepped in as interim, we were asked what space we might need for Nancy Burns over at the Millennium Building, and so I gave that information. So I can certainly happy to put a letter together, but I can also verify too if our department was asked.
Yeah, I think that would be helpful, because I agree with Joanne. We need to start the conversation. Mm-hmm. I'm just kind of surprised that we weren't asked, especially since we're an important division of town, town government, and the fact that even though I do recall there was some discussions years ago when the community building was being planned, that was years ago, and things have been changing. So you have to keep updating plans as you move forward, and I don't recall ever being asked again if anything has changed. So yeah, I think we need to. I'm going to make a motion that we write a letter to the Select Board and the Town Manager, asking that we start a conversation with them, and that we were requesting space for more employees moving forward.
I would second that.
Motion made and seconded. And is there all in favor?
Aye.
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 Okay.
Point of order. This
Pardon?
pushed as it is. Just with never mind adding another person or two.
Right.
Small space.
Yeah. A lot of people working in a very small office. That's really efficient use of space.
Okay, Gail commented that, yes, she was not asked. And doesn't know that the health director was. Yeah, it's, things have changed rapidly as well. And so some of it is, as we are recognizing new positions, new responsibilities the health departments have, and the importance of it, things change. So,
and what was the question about Nancy? Was it just to find out about space, or are they thinking about moving people in and out of the Millennium?
I think they are looking at what they're going to do with the Millennium in the future and what that means and who needs space. And so I think it was, the first week after Jeff left that I was at the first department head meeting, and they said, oh, I need to know right away what you need for space for Nancy and, all of our equipment and things of that nature. So we put that together and submitted that in. But I haven't heard more about what's happening with those, that project.
thank you.
Sure.
And I just do want to point out, the Millennium Building was built in the 90s, I believe, and it had a lifespan that it is well lived past. So like that, I don't even know why we're talking about that as a building anymore, because we were supposed to, that was a temporary solution that for some reason has become permanent.
And my daughter went there. So she was one of those kids that, lived through the construction at NAB, and then went to the Abbott and had to live in Millennium, and then went to Stony Brook. She was the first year that graduated. So they've been there a while.
It's been a house to many of us, that's for sure. The health department was there for quite a while.
Oh, really? Oh, I didn't realize.
Yeah, the health department moved there too. Yeah,
Mhm.
and then moved around.
All right, well, now that we're, I think, completed our discussion of ARPA, and thanks, Ray, for your work on that, getting, that breakdown put together quickly and submitted.
Yeah, thank you, Ray, for doing that.
No problem. Sure.
Let's go back to our COVID updates. Ray, would you like to provide us an update on our current numbers?
Sure. So as of Tuesday of last week, we were running in about 120 for our positive COVID cases. The ages, I've posted that information on our social media platforms, our town website, and we have updated that site to reflect where we've had lots of calls where people can get the booster vaccine, who's eligible. The CDC came out this week with information on 16 and 17-year-olds can now have access to booster vaccines. This past Thursday, we had our second clinic for the kids here under 12 in Westford. They received their second COVID vaccine. We had a little over 300. And so Gail actually has another clinic this week. Wednesday, we have about 50 doses left. So we are setting up a second round for any kids, which is full. They immediately fill. So that's a great thing. As you can see by the data sent, the cases are increasing in our community. Our school nurses are quite busy with student contact tracing. The Department of Public Health is rolling back on some of the contact tracing requirements. They are asking that we still follow all high-risk populations, as well as children, seniors, folks with immunocompromised systems. And so we are doing our best to keep up with all of our cases here in town between the help of the schools, with our department. Like I said, we are in desperate need for contact tracing right now. And so we have been approved to bring on 3. We have also just been awarded $110,000 from our public health shared grant to bring in a community contact tracer or epidemiologist. So we're currently working on advertising for that position.
An epidemiologist / contact tracer?
Correct.
Oh, that's great. Okay.
Yes. Yep. So we are looking at bringing on someone that would be a shared position who works remotely. But we are looking to bring in 3 contact tracers just for the community, and 1 to be assigned specifically to the schools to help the nurses with those cases. They're going on school vacation week, so we're trying to get these positions online as soon as possible.
Okay, great, Ray. Thanks. A couple of things that I wanted to bring up, and some other things. First off, I want to say thank you to members of the community for getting vaccinated. Our vaccination rates in town are great, and the state is, the message from them right now is vaccination, vaccination, vaccination. That is still our best tool in allowing us to deal effectively and combat as best as possible COVID. So please get vaccinated, get boosted. That's our number one thing to be doing. Masking is also an important tool, and I think that we are comfortable for the most part. Probably, I don't know if anybody feels differently, but I'm hearing more comments about the importance of masking right now than anything. Being careful when we're traveling, when we're out in public, and doing our best, because we know that the numbers aren't great right now. Sue asked that we bring up a couple points that she was unable to do herself since she couldn't be here tonight. But one of the things that she wanted to make sure people understood is that when people test at home and get an at-home positive, they're supposed to report that to the health department. She pointed out that it's actually pretty important, if you get a positive COVID test, that you follow that up with an actual PCR test. Because, for example, if you decide to travel in the future, within say 90 days, and you're required to have a COVID test for that travel, and you go and you get that COVID test and it comes back positive because you had COVID, you will not be allowed to travel unless you had a Maven reported positive PCR. They will tell you, sorry, you have to go home and isolate for 10 days. No, you cannot travel. I'm sorry, you had an at-home positive test. That's great. You can't travel. So I hope I'm being clear in understanding, stating that if anybody wants to, but you need to, if you are positive for COVID, it is the wisest thing to get a PCR test for confirmation of that so that it is reported and in the system, or at the very least have yours reported into the system, which means you have to contact the health department. Joanne?
No. Just to be clear,
Okay.
if you have a positive at-home test, we cannot put it into Maven as a confirmation because it's unobserved.
Okay, they previously had said that you could, but they're saying no.
We can put it in as, so in order to do tracing or whatever, if we want to, we don't have to because it's unobserved.
Okay.
So the thing to do is, you can call the health department if you want to tell them about it. The recommendation is to get the PCR. Anecdotally, personally, I know someone who had a positive at-home test, got the recommended PCR, and it was negative. The PCR will overrule the at-home because a number of things could go wrong doing it at home. And it turned out they did not have a positive test. So that's another really important reason to get the PCR. But we cannot put it into Maven as a confirmed test because it was unobserved.
So for people who think that there might be travel anywhere in their future and or other things, like it's just the best thing if you have positive, go get it confirmed with a PCR. And then the second thing Sue asked that we bring up is people have been confused about when their isolation dates begin. And she wanted people to understand that the schools will use your first positive test date to begin your countdown, to begin your clock. So if you had a self-test, they'll count from there. The PCR would be a confirmation, but they're not going to back. If you have a test on Monday and then you get your positive from your PCR a couple days later, they'll count from your original PCRs or your original at-home test as your positive date, and you're starting your clock.
Or symptoms.
Or symptoms, right? So some people are a little nervous about that, thinking, oh, but if I go get the test, then it lengthens my time. It won't lengthen your time. So, and Delta is still accounts for the majority of the cases in the state. As of Tuesday, they were saying that it was over 95%. We do know Omicron is present and will probably be spreading, but currently the main variant is Delta. And so does anybody have anything else they want? Ray?
I just wanted to say, from what we're seeing here in the cases here in this community, thankfully the cases have been mild with symptoms. They're presenting as a sinus infection, congestion, cold-like symptoms, no surprise there. That is something that we're seeing, and I would say over 85% of our cases. We are seeing a lot of folks that are already vaccinated. It doesn't seem to discriminate with age. So we're seeing it in kids, we're seeing it in 30-year-olds, we're seeing it in older folks. I would just wanted to add that with the holiday season coming, there are a lot of personal choices out there. I would say keep your immune system up, health, exercise, good nutrition, use the tools in your toolbox, hand sanitizer, good hand washing, wear a mask, try to stay away. I know it's hard. My family, we hug and kiss everyone, when we come in, when we leave, and it's hard. And everyone wants to get together. But, I just wanted to mention that with the holiday season coming, that's what we're seeing here in the community. Go ahead, Joanne. Sorry.
So I wanted to just tag team on that to add testing. So home tests do have a place, and it's a good way to, be able to do that kind of in the privacy of your own home. And I think a lot of talk is always about, before you go, test, but it's also after you come back. So testing is where we're going to really see the disease burden in the community. And, the governor had an announcement today, which I'm sure everybody will be reading in the paper about, free at-home test kits being distributed. So some communities like Westford didn't get any, the community I work in didn't get any, but we'll be working on that, I'm sure. But there's also over 100 different Stop the Spread sites and other sites that you can go and get free testing that will go into the state data system and into the Maven system. So testing is available, it's out there. And I just want to encourage the testing piece, because it's not just about before you go, for the holiday get together. So more, it's good so you know your own status. But when you come home and it's a few days later and you suddenly get a cough and you were with people that you're not normally with, or even people you don't even know, that's really an important time to test. So just keep that tool in the toolbox as well. We've got lots of tools, and use them all.
Thanks, Joanne. Yeah, that was, I think, Zach, you wanted to say something?
Yeah, kind of to piggyback on your thing, Joanne. I saw that basically ARPA funding will be allowed to be used to pay. So basically 102 communities will, at a certain poverty level, will be able to get these free. And then other communities will be able to use ARPA funding if they want to. I just wanted to ask the board, I think it might be smart to put in for some amount of ARPA funding to get these tests, because I think they are a really useful tool. Maybe it'll be too late because we probably won't get them by the holidays, but at any point going forward, when you're going to have, family over, it is a great tool for families to use before travel, after travel, before groups get together, after groups get together. A year or two ago, people were paying, $150 each to get these tests, and it was basically you couldn't find them. Now they're, about $12 each, which is great. But still, for a lot of people, that might be, prohibitive. If the town can get a hold of enough of these so that we could distribute them to people who wanted them at hopefully a cheaper price or maybe for free, I think it could go a long way to help keep the community safe.
There was actually an email forwarded to me from a community member who had proposed, I'm trying to see it now, that the town use ARPA funds to purchase them. They suggested that, they could be available and distributed through the food pantry, library, and town hall or something like that. And I think that's a great idea.
I think the one thing we got to keep in mind, though, and, I was listening to the governor today, cringing a little because there was lots of information that wasn't given out. Specifics about this particular test, because it's different if you're symptomatic versus when you're asymptomatic, and whether you need one test or two tests. So there's a lot more information in the directions, and that will make a difference too, in terms of how you use these tests. And this is just one particular test. There's, 10 different manufacturers or something tests out there. But I think, again, if people are listening, one of the take homes is read the directions. There are certain circumstances where you have to do 2 48 to 72 hours apart in order for it to actually be considered a complete test. So there's some more nuances to it, and we don't have prices yet. Zach, they're supposedly still working out some kind of a bulk state contract pricing. So I know, I'm dealing with that too. Like, how much do we put aside? How much do we ask for? We don't know. But yes, I agree. We should try to get try to think of some equitable way of distributing them, because, you could use 3 a week. I mean, who knows? So we have to think of a way to get them out to as many people in the best way possible. It's not like we can provide them every single day of the week, but definitely, do this going forward.
Right.
I noticed, Ray, that you had on line 33 of the Excel spreadsheet that you had put in for $10,000 for rapid test kits. Was that I mean, obviously you didn't know about this, so was that's a separate thing, I'm assuming?
It was. So that was put in for town employees.
Okay.
Yeah, we could get Binex tests, prior to this, but, they're hard to find too. So hopefully this will be even cheaper, and whether it probably won't be Binex, it'll be another
brand.
Yeah.
The ARPA requests have already been submitted, but perhaps tomorrow night, Ray, or I don't know, we can express that, yes, we support this request. I don't quite know how at this point.
Yeah, and my understanding is there'll be several phases of approval, so I will certainly find out, sure, how we can get that in.
Yeah. And they know it just happened today too, so.
Yeah. Okay. Then, sorry, which screen am I on? Okay, so at this point, are there any other COVID comments from board members, Ray?
I just wanted to mention we do have some folks that have their hand raised.
Right, that's what I was gonna then ask. So again, we're gonna limit the time to the next 15 minutes and ask people to speak for no more than 2 minutes and limit them to 1 time to be recognized. Please no foul language or negative comments and stick to your point. Please make your request quickly and allow the next person to speak, and remember to state your name and address for the record.
Okay, so the first person we have is Marsha Young.
Unmute. Okay, can you hear me?
Yes.
Okay, so our latest
Sorry, name and
data-
address, Marsha, please, for the
Marsha Young, 26 Acton Road in Westford. And you mentioned that our latest test date is 120. I tried to get that online. Ray, remember we talked and you said the data packet would be online prior to the meeting, but it wasn't online.
For the packet?
Yeah. There was no data packet.
I can double check for you, sure. But if you're asking for the numbers, those are already posted on the town website.
Oh, not under the
Numbers,
house book?
there's actually a list each week of what the COVID numbers have been.
Okay, so of that 120, how many of those have been hospitalized?
I don't have that information.
I mean, you said 85% of them were mild. Were there any hospitalized, or do we have anyone die?
I don't have that information. I'm sorry, I don't. I'd have to check.
That isn't information that you track, or you just don't have it?
No, what happens is when we're notified about a case and we contact trace the case. And for instance, if they finish their 10-day quarantine or they're in day 8 after we speak with them, if they should end up in the hospital, we don't have that information at the time. We roll on to the next case, but we could certainly look and see what we could find.
Well, it seems to me that if we're making decisions about whether or not we need masks, if we have very mild disease, it's very different than if we've got people going to the hospital and dying. So it seems to me that it would be something that we should be tracking and understanding. Are these 120 cases very mild? Because a lot of them are basically non-symptomatic. So how do we know what is the criteria that we're going to use to end this masking mandate? I mean, infection rate is not good. What is a better thing to look at is how severe the disease is and whether people are hospitalized or dead,
Well, if I could just say something here. I mean, if you're infected, you are a spreader. You may have a mild case yourself, but it does not mean that you are not infecting other people who are going to get severely ill.
That's true, but the people who are going to get severely ill in most cases are going to be unvaccinated.
Right. Thank you, Marsha. I appreciate that. Was there another part to your
Yeah, what is our vaccination rate since you said it was very high?
Yeah, it's great. We are, as the last reported numbers by the state, our 5 to 11s, we're still at only 24%. And we have to realize that our 0 to 5s are unvaccinated. But our 12 to 15s, we're at 89, our 16 to 19, we're at 95. As well as were the 20 to 29s. And above that, we're at about 91 to 87. So our vaccination levels are good.
All right. So all of that, in my opinion, contributes to the decision-making of whether or not we should have masks.
Okay.
When most of the population is vaccinated and we're not having people hospitalized or die.
Okay.
It seems, what will be your criteria for removing the mask?
I'm sorry, but I don't want it to go that something was said that was not true. To say there's no hospitalizations and no one's dying, that is not true. Ray just got through saying we may not have the data that you need at this moment, but that is not true.
Marcia, the state this week was very clear that our hospitals are in a crisis state again, that COVID is definitely contributing to that, and that it is a real concern moving forward. I'm going to end your comments now because
wait a minute, I have one other thing. I mean, all of the nearby towns do not have mask mandates.
That's not correct.
Oh, which one does?
Ray, would you like to share what has been said? And thank you, Marcia, for your comments. Oh, you're muted, Ray.
Sorry, I'm handling your panel here. There is over 112 different communities that do have a mask mandate. And actually, my understanding today, just Salem, Mass, instituted a mask mandate. So Marcia, if you want to send me an email, I'm happy to send you that list.
Yep.
Okay. I mean,
and Marcia, I'm sorry, you're done speaking now. We're going to move on.
You know,
but I am going to comment.
You don't need to be so rude.
I'm not trying to be rude. I'm trying to give everybody an opportunity to speak. I'm sorry. But there was our area of Middlesex, whether or not the other towns are choosing to have mandates or not, our surrounding communities are doing terribly. They are worse than most of Middlesex County on our COVID rates. And so it's a problem. So, but I appreciate, and I know that the board is discussing, mandates moving forward. We'll be thinking about things. And I do appreciate the concern and the questions about whether and what and how we will be moving forward with or without a mandate. Next. And I'm getting my timer set. Sorry, people.
Kathy Lynch.
Okay,
Go
Kathy.
ahead. Kathy?
Hi, Kathy Lynch, Rush Road. Members of this board repeatedly claim that COVID injections are safe. While some may feel mild symptoms after their shots, others have severe reactions, even death. And no one knows the long-term effects. Parents and children as young as 5 are getting injections without even knowing the ingredients. The Pfizer injection includes messenger RNA, lipids, polyethylene glycol, tromethamine, hydrochloride, sucrose, and sodium chloride. Most people don't know what these chemicals are, but more importantly, what the risks are. From the FDA website, the side effects may include arm pain, rash, itching, hives, chest pain, tiredness, chills, decreased appetite, diarrhea, difficulty breathing, dizziness and weakness, fainting, fast beating, fluttering or pounding heart, fever, headache, injection site pain, redness, swelling, joint pain, muscle pain, nausea, vomiting, shortness of breath, swelling in the face and throat, swollen lymph nodes, and very disturbing reports of myocarditis and pericarditis, inflammation of the heart. Cardiologist Dr. McCullough reports that, listen carefully, children aged 12 to 17 are 5 times more likely to be hospitalized with COVID jab-induced myocarditis than they are to be hospitalized for COVID infection. The FDA website admits these may not be all the possible side effects. Serious and unexpected side effects may occur. The effects are still being studied in clinical trials. The FDA site directs people to report side effects to their vaccine adverse event reporting system. Currently, it shows 103,000 hospitalizations and 20,000 deaths. For all the above reasons, to call these experiments—
Hey, Kathy, your time is up. Please make your point.
I'm right on it. To call these safe could be misleading and dangerous. You need to make sure all are fully informed of this, stop promoting them as safe, and for any medical intervention, provide opt-outs and choice.
Thank you for your comments. I'm just going to say that I am confident that the vaccine is overall a very safe thing, that it is our best way to prevent serious illness, that the risk of myocarditis is greater from COVID, significantly greater from COVID than it is from the vaccine. I don't know if there are any other board members who have any other comments in response to that. Those. Okay, we can go on to the next. Sorry, Ray, you're muted.
Nope, that's okay. Next person is Tammy Blakesley. Go ahead, Tammy.
Okay, am I unmuted now?
Yes.
Can you hear me? Okay, thank you. I'm not a resident of your town.
Okay, but we still need your name and address.
Oh, sorry. Tammy Blakesley, 162 8 Lots Road in Sutton. I am president of Environet. We're an occupational safety and health consulting company with 30 plus years of OSHA, DOT, and EPA experience, as well as a board certified industrial hygienist. I was asked by one of the parents to come address your board on the efficacy of face cloths. 2 minutes is really not long enough to speak to the methodology of respiratory protected devices, which would take me an entire day of training to impart what amounts to cursory knowledge and still would not qualify you as an expert. Only somebody who has had actual experience, hands-on experience, would be considered an expert. And given the time constraint, all I can do to back this up is that I have given expert testimony in a court of law under pains and penalty of perjury that cloth face coverings do not help even a little bit to protect the wearer from a virus or stop the wearer from transmitting the virus. CDC knows it, Fauci said it, OSHA knows it, Baker even just announced 2 hours ago that there'll be no new mask mandates. He knows it. Only a properly selected, fitted, and worn respirator provides the necessary protection against a virus. Ventilation has been and always will be the primary control measure for removing air contaminants such as viruses. Even one air change an hour has shown to reduce the risk by 40% compared to 10% for fully masked people. 4.5 air changes provides a 90% risk reduction. Vaccines are also not a control measure. They do not stop the person from getting an infection, and they do not stop the person from spreading it. It is not to be used as a control measure. Wearing face cloths outside when no one is around shows the amount of mask psychosis that has been inflicted on humanity. There is at least one study I'm aware of that showed mask wearing leads to respiratory influenza-like infections, which confirms what I have already known. Then the known psychological harm that has been again confirmed in at least one.
The timer is going off, so please make your point.
Okay. So basically, my bottom line with this is I want to share my concerns both professionally and personally, is that I may not end up practicing as an industrial hygienist because the CDC and OSHA have put me in a very difficult position from a liability standpoint, in that if I try to help a business not be fined.
Please, Tammy, you need to wrap up your comments.
Okay. Then the bottom line is you need to consider your personal liability, that you can actually be sued for the harm that you are doing, because everybody that is out there is going to claim plausible deniability. So I'm trying to be as compassionate for you.
Thank you.
Thank you.
Thank you. All righty, we have Olga Fredkin. Go ahead.
Hi, Olga Fratkin, 34 Caldwell Drive, obviously in Westford. So I wanted to reiterate a little bit what obviously was mentioned here, but I wanted to ask the Board of Health members what scientific data you using to continue mandating masks for every member of Westford community age 5 and up. Have you had an opportunity to do harm benefit analysis, especially for kids? So a question for public record, formal request. Another question that I have, when you count case numbers that are posted on Westford website, if the same person tested positive multiple times during a week, do you count, or 2 weeks, do you count it as a single case, or you count it as a case for every positive COVID test? Question for public record, formal request. Could you please, and it's already been asked, provide the numbers for hospitalization? Maybe what is a breakdown based on vaccinated, not vaccinated, different age groups? A majority of people who hospitalize have any underlying condition. If you can add this information to the website, I think it would be actually very helpful to understand how severe the disease is, and how actually, if it's just a kid is sneezing or coughing, I don't think it's actually considered as very severe disease. So you continue to ignore a natural immunity. How many people, especially kids in Westford, have a natural immunity? I know you're getting this information, so I would like to ask for question for public record, formal request. And just to wrap it up, I would like to address the accusation of violence during Westford standout that has been made during the last Board of Health meeting. I called today Westford Police Records Departments. There actually were 0 complaints on September 30th and November 3rd. That's where we had the standouts. Okay. When we are all made, we all have concern about the divide of our community, mainly because of the mandates that made.
Well, the time is up, so please wrap up.
I'm finishing the sentence.
Okay.
Thank you. So the mandates that made based on emotions and not the real facts or scientific data, I believe making such an unfounded accusation is causing a deeper divide. Thank you.
Okay, so there were a lot of things brought up there. It would be great if we had access and ability to report all of those things. If we get extra money for some of our ARPA requests, maybe then we'll have the ability, but I'm not even sure we can, and there are privacy issues also.
No, but just the numbers. We don't need names. We need just the numbers, but just to throw there how you calculate the cases, how severe the disease. I think it's very important information. And what are the goalposts? I mean, what are we trying to do?
Yeah, thank you. So I appreciate that. I think it's, something that we are all listening to the state, the advice from the state epidemiologists and the state experts on this topic, and we are paying attention to the data. There is a possibility of occasional double counting of cases, but or of the testing, not of cases. Joanne's shaking her head. We can get a double test, but that should only be one case still, right?
Correct. Yeah, so when you can test every single day, you test positive every single day, it's still one, because we know that within, once you test positive, you can still test positive. PCRs are very, very sensitive. And if you continue to test, which is why way back in the beginning, it was you needed the negative test to go back to school and the negative test to go back to work. That all stopped pretty much after it started, because the PCR test was so sensitive that we're still picking up pieces of the virus. So, if you continue to test, we don't count it as a new case if you're still within the 90-day window.
Right, and if people test positive multiple times, that's just one case. Okay, Ray, are there many other people in the queue with their hands up?
There are 4 more.
Okay, I said we would go 15 minutes. It's been more than 15 minutes. I guess, board, do you have an opinion on whether we continue or?
They were interrupted.
Who just spoke?
Kathy, you can't speak now.
I don't know why Ray is still on.
So everyone is muted.
Maybe we take, two more people, go a little bit over, but hear from a couple more people.
Yeah, that'd be good.
I'm going to stick it to the max of 2 minutes, people.
Okay, so the next person is Leanne.
Good evening. Can you hear me?
Yep.
Yes.
Thank you. Leanne Kalergis, Lawson Road. The board posted a layer up for winter flyer with untrue claims. They were vaccination remains the strongest protection against COVID-19, and unvaccinated people are the most likely to spread and get COVID-19. And at the last meeting, Sue Hanley claimed that in every case of breakthrough, it has started with the unvaccinated. Where is the scientific proof for any of those statements? Science has already proven the so-called vaccines do not provide immunity or stop transmission. So you want everyone to get masked and vaccinated because they work, and you want anyone who took the vaccines to keep their masks on and get boosters because the vaccines didn't work. And you claim the unmasked and unvaccinated are putting the vaccinated in danger by not wearing a mask or getting a vaccine that didn't protect the masked and vaccinated in the first place. The only thing masks and vaccines protect against is seeing the facts and using common sense. After 2 years, it's dangerously irresponsible for you to ignore hundreds of studies which prove life-saving and immune-supporting protocols actually do and are preventing and safely treating every phase of COVID-19. The loved one of a masked or vaccine-injured family member could have used all those resources, but it's too late for them now. The board follows a one-sided narrative handed down by compliance-seeking leaders whose efforts to mask and vax everyone while suppressing all other interventions have failed us epically. And so has this board by ignoring proven science, bypassing personal choice, and imposing mandates. And for the record, all of us quote unquote sad unchristian sign holders are peacefully exercising our legal rights on the common. We stand in the gap between freedom and medical tyranny for our friends and neighbors in this town. And that's called doing it for others.
Thank you for being timely. And I do, agree that your peaceful protests on the common are completely appropriate and within your rights. Next.
Kim Rogers.
Yep, I'm here. I'm from 82 Graniteville Road here in Westford, and I'll be pretty quick. I think we all know that there is plenty of evidence out there to dispute the panic porn being thrown down our throats by the state, by the government, by the CDC, by the World Health Organizations with regards to mask mandates. So I don't even need to go in that. My question is when are we going to have the courage to stand up and use the evidence that we have with specifically the mask mandates and say no? I guess I'm asking the board to have the courage to maybe make a stance and say no. However, if the courage isn't there, if you guys don't want to do it, that's fine. If you have a mask mandate, do the mask mandate to the fullest. Why am I still going into Market Basket and not have the one-way aisles? Why aren't they wiping down the carts? Why aren't they wiping down the belts? If we're going to do it, you got to do it. So I guess I'm asking the board is why are we just saying, oh, put a mask on our face? That's going to help. That's going to end the pandemic, right? Why aren't we then going to the fullest extent? I don't agree with it. I think that, again, there's plenty of evidence to not have a mask mandate in place, clearly. But if you're going to do it, then do it. And why aren't we doing that? Because what I find to be more disturbing are people bringing in their own bags from their home. That, to me, is more of a health concern than somebody not wearing a mask? Why aren't we social distancing? Why aren't we standing 6 feet away? I get it if you want to do it. I don't agree with it, but do it. Why aren't we doing that?
Thank you. Does anybody have a response to that?
I think there's 2 more people. It'd probably be a good idea to hear from them.
Sure, that seems reasonable.
Heidi Sullivan.
Hi, can you hear me?
Yes.
Hi, Heidi Sullivan, 3 Abbott Street here in Westford. I'm calling more on behalf of my children here in the Westford Public Schools. I have a 5-year-old autistic son, and for him to wear a mask is very difficult. 1, he doesn't breathe well. 2, he does not make very good eye contact, so that is a big disturbance for him. He needs the sociability with other children, and that is definitely frowned upon in my behalf. I also have a daughter who's going to be in middle school next year. She was recently told by one of her friends that her father will no longer let them be friends or have play dates because my daughter's not vaccinated. This is the divisive stuff that's going on in this community, and it's taking a big toll on my family and everybody else here in Westford, and it needs to stop. My husband's here. He has one thing to say as well.
I'd just like to know how.
Right, name for the record, please.
My name is Jason Sullivan. I'd just like to know how other schools, like in Pennsylvania, lift a mask mandate, or other places throughout the country. Florida is a good example. They don't seem to be spiking like through the roof, like all this transmission stuff. I just think that the kids need to go back to being kids, like how we all grew up. And this thing's never going to end. I mean, it's just like the flu virus. I mean, we're all panicking and none of these kids are dying. I mean, this is ridiculous. It's insanity. I mean, when is it going to stop? It's just, and then the kids are out of school for days on end, and they got to do all these tests, and they come back negative. I've had kids stay home for 5 days, 6 days on end, or over a long weekend, and they're not getting educated. So I'm just saying it right now. My kids aren't getting vaccinated. I'll rip them out of that school. They both got IEPs. I'll send them to private schools that don't mask. This is ridiculous.
Thank you. I'll just say for the record here, for people to understand, that the state still has a mask mandate in place to be reviewed until January 15th. So regardless of what we have here in town, that is in place. And I think we have one last speaker.
You do. Alexandra Gonzalez, go ahead.
Alex Gonzalez, 2 Elm Street. It is the mark of an educated mind to entertain an idea without accepting it, said the wise philosopher Aristotle. We have a big issue right now, not only in this town, but throughout the country and world. And that issue is discerning what is true and what is a lie. I believe that you are misinforming the public when you tout experimental vaccines and masks as a solution to the pandemic. And misinformation is a lie. Right now, we know that vaccines and masks are not stopping the virus from spreading. We know that people are living in fear, clinging to the hope that the vaccine and the mask mandates will bring back normalcy. Unfortunately, they're doing just the opposite. There's a national debate throughout our country. Let's not act as if this is a no-brainer. Let's accept that it is complicated. We are using civil discourse. We want choice. We don't want to be forced. We want to be heard. Instead, we feel disregarded and even slandered. Look, if I called someone out for unchristian behavior in the corporate world, it would be grounds for termination. But when Sue Hanley did exactly that, accuse a dissenter as having unchristian behavior, not one board member stepped in to call Sue Hanley out. When a person of authority and influence calls another person a bad Christian, there needs to be real consequences. It's intimidating, it's inappropriate, and it needs to be addressed. And this brings me to my next point. Clearly, there's a lack of diversity of thought. There are no dissenting opinions on this board. Yet families are divided, companies torn apart, government disagrees, doctors and researchers have dissenting opinions. Yet the Board of Health is one voice, one impenetrable wall against other ideas. Meanwhile, small businesses are affected, people's livelihoods are on the line, the health of our children and their futures is at stake. This brings me to my final point. By promoting one solution, you appear biased, not credible. I urge you to take a more neutral stance and emphasize healthy living as well. Empower parents by giving them both sides to the issue. Why not make flyers promoting pros and cons or healthy lifestyle? Lastly, it is dubious when the school nurse, whose day job it is to promote vaccination clinics, serves on our town's Board of Health. Isn't that a conflict of interest? Perhaps it's time for Sue to step down. It is the mark of an educated...
Okay, your time is up.
Okay,
and then some.
One last sentence, please. I've been waiting for a long time. It's a mark of an educated mind to entertain an idea without accepting it. If you can't entertain alternative perspectives on health, why are you serving on the Board of Health?
Thank you very much. Appreciate your comments or not. I don't appreciate being... I don't appreciate a lot of what you said about us there. I'm just going to say that. You have a right to say it, and I appreciate that you express your opinion, but I think that it's, I would like us to be able to have better civil discourse than simply slandering us for supposedly slandering you, which I don't quite understand. I don't know that we've slandered you. I think we have simply stated the facts that we are aware of. I'm a very educated individual. We have a very educated board, a very qualified board. And I'm sorry that you disagree with our stance, but we agree at the moment that this is where we're at. So I think that will end our discussion on COVID for the evening.
Okay.
And our last agenda item is new and old business.
Sure. Earlier,
sorry, wait, before you go on, please, people, the chat should be closed. It should not be open. I'm not going to read anything in the chat. It is not a part of the meeting.
Okay, so new and old business. Town and staff flu, COVID and booster clinics. As I mentioned, we've had quite a few people call asking for booster clinics where they can find a booster vaccine, vaxfinder.com. We've also updated the town website for all that information if you're looking for any kind of vaccine for your child, booster vaccine for yourself. Gail and I have been preparing and planning for booster clinics as soon as we finish up with all of our clinics for kids here in the community. So that's something to be looking for on both our social media platforms. You can certainly call the health department office if you're having any trouble finding either COVID testing or, again, looking for a vaccine. The Public Health Shared Excellence Grant, and just a quick update on that. As I mentioned, the community health coordinator and wellness coordinator position is the third and final position to be hired for that grant. We were just awarded last week for additional funding, $110,000 from the Department of Public Health for additional shared contact tracing. And then staff, we did go over as far as our staff renewals and who's new in the department. So that is pretty much it for new and old business. I did want to mention one other item that was in the packet that just happened on Friday, and that has to do with PFAS. The Department of Environmental Protection, which is the Mass DEP, has come out with some new requirements for what is called PFAS, or a forever chemical. So that is a chemical that you'll find in Teflon, a host of products. We have information on our website. If anyone has any questions, you would certainly call the health department if you have any concerns. But we are mandated, our water department, to start conducting some PFAS testing here in this community. And some testing has been conducted in several monitoring wells. So we have put out some education and information that you see there in your packet on PFAS.
Ray, and I'm less familiar with a lot of the well stuff, but as a resident with a well, are those monitoring wells pretty well spread around town, or?
They are spread around town. However, they are not all being tested. This is a brand new program. The DEP is collecting preliminary data on PFAS to see what pockets might be what they call legacy pockets. So chemicals that maybe were used 30, 40 years ago, products that are no longer around. Is this PFAS in our groundwater? So we have just been notified that there is some PFAS areas, again, preliminary information over by the Country Road area. So we have let all the residents, a letter has gone out to the residents at Country Road just to let them know that this is in the area. They are on town water, but if anyone has an irrigation well or an old dug well on their property, this may be something they want to test for.
And generally, what is the recommendation for how frequently people who are on wells should be testing their water?
Sure. So we recommend at a minimum, if you have a private drinking water well, we recommend nitrate, total E. coliform, which is E. coli, and nitrate be tested annually with a private drinking water well. You're your carrier of your own drinking water supply, so we would recommend that at a minimum. Every 5 to 7 years, there is what they call a drinking water portable panel. And so the health department does have well regulations, in which case we have a series of items that we would recommend that people test for every 5 to 7 years for the full gamut. Uranium, arsenic, radon are pretty common in private drinking water wells in our community, in our area, due to the granite. They're naturally occurring. They're cancer causing, but they're, again, naturally occurring in our area. So more questions, if anyone has more questions, they can certainly call the health department. We'd be happy to answer that and walk them through.
So Ray, as a homeowner with a private well, I think it would be helpful to have a page on the website that instructs what we should all be testing for and what time frame, and linking up with state certified testing laboratories.
Sure, absolutely. We do have a well page on our website that has the latest information for testing, where to go to get testing, but we could certainly make sure that's updated too with the PFAS information.
Thank you.
Sure.
Zach, you had your hand up?
No, Michelle covered it really well. I totally agree, and thank you, Ray, that we have that information up there. I didn't know that. That's great, because I think a lot of people, back in my contractor days, I was surprised at how many people in town didn't know they had either well water or town water. They just didn't, hey, it's water. And yeah, so if you're in doubt and you're watching tonight, yeah, go check and find out if you're on well water, and if so, yeah, you're responsible to get it tested, and you can just decide what you test for.
Mm-hmm.
Yeah, to piggyback on that, we have had issues in the past with contaminated wells due to other releases. So it is, really important to know what your baseline is too, and so that if there is a release in your area, you'll know what the changes are. So really should do the well testing.
Thank you.
So that'll do it, Stephanie, for new and old business, unless, of course, if you have any questions.
Does anybody have any questions? I just want to remind everyone to try and be careful through this holiday season. Enjoy time with family, but be smart in your approach. And remember the best tools we have are vaccination and then masking and testing. Even though there are those who disagree. Is there a motion to adjourn?
I'll make a motion to adjourn.
Okay, motion made by Zach and Michelle.
I'll second.
Seconds. All in favor? Aye.
Aye.
Thank you, everybody, and have a great week.
Thank you.
Thank
Stay
you.
well.
Have a good holiday.
Happy holidays, everyone. Good night.
Bye.